I am Dr. Amber Brown Keebler. I'm an internal medicine and pediatrics physician. I'm originally from Mississippi. I went to medical school at the University of South Alabama in Mobile, but now I consider myself a native Nebraskan and am enjoying it here. I chose to be a physician because I always loved science, was pretty much a science nerd my entire life, and I really enjoyed working with people. I did a rotation when I was in college that was a really eye-opening experience where I rotated with an oncologist, so a cancer specialist, and I got to sit in on a family meeting, and I just realized that I had a calling to really be with people and kind of help them make decisions about their medical care. I chose internal medicine and pediatrics because I love all age groups. I especially love kids. They bring a lot of joy to my practice, but I also really love working with older patients, adolescents. I work a lot with patients that also have more complex disorders, really complex medical problems, especially those patients who may have had childhood disorders and are now growing into adulthood and getting even more complex. I really enjoy working with those patients and their families, and a lot of the skill sets from working with pediatric families and those patients really spill over to the adult care as well. I see all age groups. I treat all primary care issues, anywhere from just preventative physicals, well child visits. We do anything from high blood pressure management, diabetes management, lung disorder management. I manage all my complex patients. I kind of, even if they're not necessarily seeing me for specific things, I'm kind of their caretaker and kind of looking over all the specialists that they're seeing, reading all the notes, making sure everybody's on the same page, being their advocate, and helping them communicate if need be. So I have a specific interest in cardiometabolic risk reduction. That basically means I like to work with people on prevention of heart attacks, strokes, diabetes, any signs of insulin resistance. A lot of obesity medicine plays into this as well. So I do a lot of prevention, and then as people do develop these disorders, we really work on reducing their risk for further incidents of heart attack or stroke. A lot of times when I'm sitting with my patients and meeting them for the first time, it's a lot of questions. I like to be very thorough. So people knowing that ahead of time will give them a good heads up that they're going to answer a lot of questions, and we'll spend a lot of time during that first visit together. I would say that I chose to be a part of an academic medical center because I wanted to be in a place where I could continue to be with learners. I think number one, because I really enjoy helping these learners grow and become better providers. And I love the questions that they ask me, keeping me on my toes, and they continue to kind of promote my own education as I further myself in my career. I feel like my patients have a great benefit to this because they also contribute to the expansion of our learners, the improvement of our medical care, and I feel like they get better care because we stay on top of newer recommendations and guidelines.